Hello, everyone. A huge thank you for being with me. On this Tuesday, we have a great lineup of guests for some thought-provoking conversations. I am so happy to be spending time with you and that you would take time out to be here with me at home under lockdown in LA. In just a few minutes, we are going to go to Rwanda to get the very latest from a journalist there who's locked down there in their capital city of Kigali. From the east, we're going to go to Southwest Africa, and we're going to get the view from a Namibian doctor who's going to bring us up to speed with their response to the spread of coronavirus in that country. That doctor, Dr. Azadeh, is actually part of their COVID-19 task force, so we'll be hearing from him. He'll also be taking your questions, so get typing. Also want you to send your comments in throughout the hour. And of course, I will be reading out those comments as the show goes on. Your voice is just as important as mine. The show is all about our conversation, our dialogue. I say to you all the time that we will get through this. These are difficult days, but we will get through it. It will come to an end, but it will take all of us coming together, all of us pulling in the same direction and leaning on each other. So with every show, as you know, if you've been watching Home with Isha Sesay, you know that we end each day with the Bright Side segment. We have another great conversation to provide you hope and inspiration on this Tuesday. You won't want to miss it. Let's get started. Okay. Well, for more than 2 weeks now, Rwanda has been on a nationwide lockdown as that nation tries to defeat the coronavirus. But on this April 7th, many of you will know that it's most likely a different battle that's on the minds of many. April 7th, today, this Tuesday, marks the 26th anniversary of the brutal genocide in that nation that claimed the lives of more than 800,000 men, women, and children. It's so much going on the minds of Rwandans on this day. In the years since that 1994 genocide, the country has emerged as one of the fastest growing economies in Africa. It's also built a reputation for innovation, for tourism, and one of the premier destinations for conferences. We want to get a sense of how everything is playing out in the country today and in the days since the lockdown was called on March 21st. Let's bring in a journalist from the capital, Albert. I'm going to take my time and say this, Rudatsimburwa. Did I get it right, Albert?
You got it. It's good. No, it's straightforward. It's a long name, right?
Yeah, it's got a long letter in it, but it's okay. No, tell me though, given today's significance, obviously it was on the minds of most Rwandans, if not every Rwandan, and I know that in years past there have always been official ceremonies, but obviously the country is under lockdown right now. So how was this anniversary commemorated in Rwanda on this Tuesday?
I would say, like anything else since this last 2 weeks, it's virtual. Because, this is a time, ever since 94, Rwandans have been trying to keep the emotion for them, for what happened, and that was the only way to think of a better tomorrow and keep building and all that. But comes 1 week in April where we all collectively commemorate, and it's about being together physically, and this year it was impossible. So we had an address from the president that came out on TV and that has been replayed. Usually, what happens is that you have a march to remember after the opening ceremony. Usually, we also have by now I'd be with you, but then on location, together with so many other people, joining, being together, remembering. And it's a time when you also physically hold on people. You hug, you. It's all that, and it's not only for Rwandans in Rwanda, because we assume that it's also happening in wherever you have a diaspora. I think it's the same situation. So it's a weird, it's unexpected, it's improvised, I would say. So the more eventually talk shows, because it's also normally a time when people discuss, exchange about remembering, but also about the future, and yeah. So all of that is missing.
Yeah.
But I mean, as Rwandan, I would say we've been trained now to be resilient. And because the other good news also we had today, I would say, is that this is the first day that we don't have new cases of coronavirus, and there were like almost 1,000 tests, and another 3 people have recovered from the quarantine and now are going to leave. So this is already 7. So at least I would say this balances with the absence of the opportunity of being together.
It is good news, and at times like this, we need every sliver of good news that we can get hold of. Talk to me about lockdown, though. How is it being enforced? And give me, a sense of compliance. And if possible, I'd like us to move beyond Kigali, because so often when we talk about Africa, sometimes we can just focus on those big cities. I mean, do we have a full picture of how well enforced and level of compliance throughout the country? What are you hearing?
Well, if you compare to the numbers, we have a total population of 12 million, almost going to 30 million. So I would say in general, things are going the way they should go. People are complying. But of course, you have some examples of especially when it comes to religious people. It's always for them tough to understand that they cannot do what they usually do, and it's sometimes difficult for someone who doesn't want to reason to just use rationality. So police is the enforcer. They've arrested a couple of people that they put in a stadium a couple of days ago, but it's like 60 people who then were explained why they had to, of course, do that. Now, the other side of it is that the whole informal economy that is a third world country living from, where with a lot of people, in fact, living from day-to-day works, and this has stopped. So we saw from the beginning, I would say, in all different communities where people who had some means put together and try to support them. We also had different corporates also giving out. And now at this stage, actually, the government has decided, I think we heard it yesterday or the day before, that the government will give out the 1 month salary already of all the government members and heads of institutions to support even more, because of course it's never enough. Yeah. So these are. It's also a way for everyone to understand that we are in this thing together.
Yeah. Rwanda has won much praise for the fact that you have pretty early on in the situation, set up a program to help the vulnerable there in Rwanda with food items to help them during this difficult period of this lockdown. Again, given the fact that I'm seeing by some estimates that a third of the population is living in poverty, how far-reaching is that government effort? How many people are benefiting from it? Do we have a sense?
You see, what we had also before, prior to this whole outbreak, is actually we did have. First of all, I think we're the only country on the continent here that has a healthcare system
right.
that covers around 98% of the population. So we do also have a social assistance system for the most vulnerable. We had something in place already for normal life, for the usual. It's now just putting more weight on it, on the need, also that everything has to reach those people. You know, you might always find individuals who are trying to eventually go for their own personal interests. But I would say in general, we're pushing deeper and deeper just to make sure that, because these people have to, for them to be part of it, or I would say for Rwanda to really win this war against this pandemic, everybody needs to be included. And luckily, we already had a system that thinks inclusive with the means that we have. We're not a first world country. We're still a third world country.
Well, you know, that is true, but it is also still very impressive to see how the nation is pulling as one in this moment. And I know it's the envy of many countries, including my own, Sierra Leone. Albert Rudatsimburwa, it's such a pleasure to speak to you and to get your view of what's happening there in Rwanda. Please come by again and keep us updated with what's happening there. Be safe.
And while you are there, well, I wish you the best. Stay safe at home. Thank you for what you're doing, because you keep connecting the whole world, and we have a view of what is going on elsewhere else, and especially in Africa. And remember, our life motto in Rwanda is life is a gift, but humanity is a privilege. You got to live up to that privilege.
Amen to that. Thank you, Albert. Speak soon.
You.
Take care. So there you have it, a bit of a sense of what's happening there in Rwanda from Albert Rudatsimburwa, who says this lockdown is being enforced with the help of police, but by and large people are complying. I was very touched as he explained the situation there on this particular day, April 7th, where the country is commemorating the 26th anniversary of the genocide. The fact that that moment through the years has been an opportunity for people to gather as one, as a community, to lean on each other, to console each other, to strengthen each other, to physically touch each other. And because of the coronavirus, they were denied that opportunity. They could not do that this time. And so the commemoration has been a virtual one, and has been one that has involved, the president giving an address on television, which is being replayed. But that essential human connection, that kind of standing side by side, taking part in the march that they normally do, the March to Remember, they were unable to do this year in Rwanda. The coronavirus is impacting life in so many ways, big and small, and that part of the show to kind of highlight that, of course, there's the health element, people losing their lives, which we pray for that to be minimized and for this all to come to an end. But it's also taking into account how it's impacting every other element of life. Please keep your comments coming. I want to read this one from Mwangi Maina. He says, watching from Nairobi, Kenya. Thank you for that. We want as many comments as you've got. Please keep them coming. I'm going to refresh my system. This from, it's refreshing. These viewer comments. And then that one just disappeared. There was one from Eddie Long who was saying that Rwanda is doing an impressive job. Keep those comments coming in, and I'm going to read as many of them as I can throughout the show. But we're going to move on now from Rwanda, and we're going to talk about the situation. From Rwanda, we're going to talk about the situation there in communities across the continent where individuals are doing remarkable work. They are doing remarkable work to meet the needs, to support the vulnerable, and to really bridge the gap that undoubtedly is widening given the scope of this pandemic. I want to tell you about a woman who's operating in Nigeria and Ghana, and she runs a remarkable organization that basically is helping mothers and is working in the space of maternal health, maternal and infant mortality. Take a look at the conversation we had, and I'm sure you'll be as impressed as I am by the dedication of so many in Africa at this moment in time. Take a look. Nono, welcome.
Thank you. How are you?
I am good. I'm good despite the lockdown. I'm good. Yes. How are you?
I'm surviving. I have a 7-year-old. I'm surviving.
Yeah. Day by day.
Day by day. Out minute by minute, actually.
I know that you have a not-for-profit, Africa Health Now, and you're working in Nigeria and Ghana before this moment of the coronavirus pandemic. Talk to me about the focus of your efforts now on the ground, because I know that your effort really is water and sanitation. So talk to me about what you're doing in this moment.
Yeah, so now for us, we partnered with an organization called Zero Hunger. And this is kind of one of those opportunities where we do a lot of primary maternal health care. And that has always been our kind of the foundation of the work that we do around non-communicable diseases, and then around maternal health and getting women into pregnancy schools and making sure they have clean and healthy, safe births. So whenever there's a crisis, specifically in Ghana, you kind of feel compelled to go into action. And so we have this great opportunity with Zero Hunger, who does a lot of feeding of poor kids and inner city kids within Jamestown and throughout Accra. So when they sent to us and said, we're going out into the community, we know we're on lockdown, but lockdown will not work in Ghana because the communities that are affected the most have no running water. Yeah. And those are the places where I work to chop. The mathematics is very clear. If I make 10 cities, I got 10 cities to eat. If I make 200 cities, I have 200 cities. If I make 0 cities, I got 0 cities. And so the notion that that people would be able to stay at home is really challenging for a lot of people in Jamestown, in Medina, and Malam, in certain areas. So she said, how do we fix this? And we decided to just rent water tankers. And she, Deborah Jane Nelson, who we partnered with, we rented water tankers. We bought trucks of pure water sachets, and we went into the community and distributed. So now at least you have bathing water that you can come bring as many buckets. Each family can bring 2 buckets or 2 of the big pans, the Kaye pans, and they collect water, and then they each get a sachet of 24 water sachets for drinking. And then they got rice, they got soap and sanitizers, all things that we were able to kind of pull together to make this a really effective campaign. And so the goal is to continue to go out. Thankfully, the president has just announced that he is going to be deploying military water tankers into certain communities to provide them with free water. And he suspended water bills for the next 3 months for all of Ghana.
So let me ask you this, because again, to give our viewers some context, how big an issue is this? Is it when we're talking about access to clean water in Ghana? I mean, what are we talking about in terms of rough sense of the population that you would be hoping to target?
Rough sense of the population as a whole of people who have access to clean running water. I turn my tap, it comes.
Agreed. Yes.
That we're looking at almost half of the population, if not more, does not have access to clean
turn a tap on and water comes out.
And water comes out. And water comes out that I can drink, water comes out that I can use. So you're thinking throughout, even let's just tap it in Accra.
Yeah.
Even within Accra, you're still looking at least 70% of your population don't have access to clean water. And that for us and that's when we do our work, when we do, even prior to this, that was what we were always coming up against. When you're thinking about when you're talking to someone about access to healthcare, and you're talking to them about going to the doctor and the need to advocate for themselves, you're 17 steps ahead of, do you know where I took a bath today?
Yeah.
Like, do you even know how I bathed today in the morning, where I got water from for me to bathe and got enough of a bucket for me, then my daughter, and then my child, and then had to go back and get another bucket for my husband, or people who live in those compound communities that still have to use public toilets, and I'm paying for public toilets. So the fact that we have public toilets in communities where people live, it's still that's all part of the problem when you say stay home, when you say, practice social distancing. There's 50 of us here in a compound. Where am I going? And the only difference is that these 50, if you live in Jamestown, the likelihood is that you don't leave Jamestown to go to East Legon.
Yes.
So it's like a lot of the communities are insular, but we're not equipped for even to have a pandemic in one concentrated area. We can't handle that.
So, you mentioned the president getting, more water out to people, suspending water bills. I mean, clearly a good thing, but put that in context in terms of the response and taking into account, the nuances of the situation. I mean, what's your assessment of the government's response and handling of this pandemic?
I think he did a really great job. And we actually, that should be very clear, we oftentimes don't even deal with government entities. We really work so for the first time, I could say that I think he was really, he was steadfast in understanding what this, because we also, he knew the infrastructure and the lack of infrastructure that we have. And if this gets out of hand, we could not afford, Ghana cannot afford for this to beyond this 218. Unfortunately, we will probably see some higher numbers in May, and those numbers will escalate. But the fact that he was willing to go in hard and put in the lockdown, shut down the churches, shut down the funerals. I think Kumasi alone has a funeral. There's 100 funerals happening a day throughout Kumasi, where 300, 200, 100 people are gathering every single Friday continuously. My grandmother being one of them, goes to 4 funerals a day. You'd be like, who do you know? How did you know those people died? How? But so thinking of it that way, once he put in action, that showed the citizens that he's taking this seriously. I think what the only disconnect is that the majority are not educated enough to really understand what this means.
Understanding the cultural nuances and being able to tap into them to bring about behavior change. So for you, from all the things you've learned from doing this work in different parts of, of the continent, for you, what's the key now as we look forward and try and get the situation under control?
It's almost like a redundancy of education. It is a constant conversation. It is a constant. The way it works in America is that you see information on your TV so much that you actually know what certain drugs do. Not even diagnosed with it, but you have that information. Yes. It's almost creating a system where it's like everywhere they're going, they have to be hearing it. Everywhere, from their pastors have to be talking to them. The imams have to be talking to them. The spirits, everyone has to be talking about the same thing and creating the same message. And if that message is the same, then there's no space for misinformation.
Well, Nana Isha-Akiwowo, I want to thank you for the work you're doing the partnership with, Zero Hunger, which, allows you to keep following your mission. At a time like this, we need all the heroes we can get to
all
keep
hands on deck.
So thank you.
And thank you. Thank you for telling our stories, for always telling our stories. Thank you. Thank you so much.
Thank you. Stay safe. Nana Eyeson-Akiwowo there. We spoke just a short time ago. Again, just remind you the name of her organization. It's African Health Now. And every day on the show, we want to spotlight the angels, the people who are doing work at this particularly difficult time, a time where being out amongst people you don't know, even amongst your loved ones, can be a source of problems. It could cause disease, it could bring harm. So the fact that these people continue to get out there, continue to do this work, we want to celebrate them on the show each and every day. So Nana Eyeson-Akiwowo there. All right. You've been sending in some comments. This one from Camille Hart. She says, great work you're doing. Thank you. Another shout out for Nana. This is from Karen Good Marable. Love Nana Eyeson-Akiwowo. Mwangi Minor says, Aisha, guys need to know that Africa is a very unique continent. This pandemic is and will continue testing us. We only need to remain unbowed. We shall overcome. It's just a matter of time. God bless Africa. And if you're watching, everyone, please hit the share button. We want the show to go far and wide. We want everyone to know that we're having this conversation about the coronavirus and its spread in Africa. This is important. This is a side of the story that needs to be talked about more. And we need to spotlight what is happening on the continent. So wherever you are, wherever you're watching from, if you're watching on Facebook, hit the share button, please. As we talk about what this virus, what the disease COVID-19 is doing, we also want to take a beat to remember those who have lost the fight against this scourge. This moment, this disease brings so much grief to so many families. So many people are heartbroken right now, and we want to spotlight as many of them as we can on this show, Home with Isha Sesay. Today, we remember the former Prime Minister of Somalia, Nur Hassan Hussein, who died just a few days ago from COVID-19. He was Prime Minister of the country from 2007 to 2009. He's known for overseeing negotiations and signing a peace agreement in 2008 during Somalia's humanitarian crisis. He died in London on Wednesday after being treated at King's College Hospital. He was there for just over 2 weeks, and he sadly lost the fight against COVID-19. Hassan was 82 years old. We send our thoughts and prayers to his family and his loved ones. Turning now to the situation in Namibia, where a national emergency has been declared and 2 regions are operating under a lockdown right now. Currently, there are less than 24 cases in that country, but the fear in Namibia is the same as it is in basically every other country in the world, that the situation could change suddenly and that this virus could spread rapidly. I want to get more on the situation there in Namibia from a doctor who is actually part of the country's COVID-19 response task force, Dr. Ahmed Azadeh. Dr. Ahmed Azadeh joins me now from the capital, Windhoek. He's also the director of the Macquarie Medical Center. Dr. Azadeh, can you hear me?
Yes, I can. Can you hear me?
I can. The audio is beautiful. It's like, it brings joy to me.
So I guess this microphone is working.
It is working. Thank you so much for taking time out to just share what's happening in Namibia. As we said right at the top, less than 24 cases. But my understanding is that there isn't widespread testing. So bring me up to speed with the government response.
So we are actually on 16 cases now.
Okay.
We're in our 3rd week of the lockdown. So once the first 2 cases were announced, I remember it was a Saturday, I guess 2.5 weeks back. On the Sunday, we had an emergency meeting already with a lot of the various stakeholders, the medical associations, which I was part of, the executive director from the Ministry of Health, the deputy came in, as well as an emergency room doctor from the state system, the pathologists, private physicians, just to really sort of help understand what is going on and what the government's take on it and plans were. And already from the first moment, they had planned to do some sort of a shutdown or a lockdown, which escalated very quickly. I think the fear really was that we could see the countries with that first wave of the pandemic hitting them very quick and very hard, and their health systems really struggling. And that is still the biggest fear for our small country. When I say small, we're a big landmass, but we're a tiny population. Mm-hmm. We have 2.4 million people, and we're the second most sparsely populated country on Earth. Really filled with two big deserts for most of our landmass. Mm-hmm. But yet we have some real challenges. We have very much a dual nature, an urban population and a very rural population, a sort of well-developed private healthcare system, but the majority of the population is relying on a very under-resourced state healthcare system. So we just don't have the capacity to look after a proper wave of pandemic hit on our country.
And so that being a case, do you even have a percentage of how many people have been, or the proportion of the population that's been tested? Because, I mean, we know it's up to 16 cases, but it sounds as if it kind of, I mean, this is the expression we use, pretty much blind to what maybe the real situation is.
Yeah, I remember, I think in the first weekend the first week, there was it's probably a joke when they asked the Minister of Health, one of these small countries, and they said, the world is getting so many cases of the COVID-19, but you haven't got any cases. How are you doing it? He says, it's very easy. We're not testing anyone. But ultimately, we've tested about 300 individuals. So it's very much, we have about 300 tested individuals. And 16 came out positive. Mm-hmm. Most of these are people with high indexes of suspicion. They've been in contact with someone who was confirmed positive, or they had traveled from a foreign country with known cases and were showing some symptoms.
But, Dr. Azadeh, just to jump in there for a second, did Namibia not get any testing kits from the batch sent by Jack Ma to the continent?
We did, and that's where we've been testing them. But it's a very limited supply, so we're not just doing widespread testing. The other thing to realize is when the prevalence is very low. So, for example, they say whatever you've tested positive, you may give it an order of magnitude of maybe 50 times. That may be how many circulating infections there may be. Mm-hmm. So 800, let's say, in the country. They've been doing active contact tracing and isolating those individuals and testing them then. So that number hasn't been massive, mm-hmm. thankfully, because we're, relatively small in number. But our ability to test more than that is limited. So we have luckily been able to do testing locally. In the first days, we were, depending on sending samples to South Africa because they had the facilities, but we managed to set it up with our National Institute of Pathology so they can do testing locally. But it's all about, the reagents are in short supply.
Right.
So the case management team is very, not selective, I would say, but very aggressive with isolating, tracing contacts. And that is, I think, a very useful system to have in place because traditionally that has worked very well for most countries that dealt well with SARS and with MERS in the past, was the contact tracing and isolating.
So let me ask you this. I saw, as I prepared for our conversation, a report by China Daily in which they're saying that there was a conversation between China's President Xi Jinping and Namibia's leader in which China pledged further support to Namibia in its fight in this pandemic. I was wondering whether you could tell us what level of support China is giving Namibia currently.
Well, I think at this stage the case management committee is really looking at putting together rapid response teams to be able to respond to the various regions where the pandemic may break up and really upscaling our critical surge capacity. So that's a lot of the beds, hospital beds with oxygen for a lot of the moderate, or I should say severe cases. And in the critical cases, really it's our ICUs and ventilators and then training for staff. So that is where a lot of the support will be coming and pouring into. I know that our country has very close ties to China, so I don't doubt that when the need arises, the help will be there if it's not already being offered. Our biggest challenge as a nation right now is we're just coming out of 5 years of drought in sub-Saharan Africa. So we are, one of the economists I was on a talk show with, he's saying, this is a disaster within a disaster. So we are just trying to recover from the drought, which has decimated our economy, and now this has happened. Yeah. And the biggest challenge now is the informal sector is completely devastated by a lockdown, which we've been in. And as you mentioned in your intro, it has been two sectors or two provinces, if you'd say, of the country where the bulk of the population, urban population, is. But there's large proportions of informal housing, informal sector, which are surviving hand to mouth essentially, and their income streams have completely disappeared. I just heard a story today of in some of the rural areas, the villagers essentially depend on vendors just going and bringing fresh fruit and vegetable from the larger towns, and they've all been shut down. So these informal markets were shut down. They had tons of fruit and veg that just got spoiled, and all of the villagers have to now grab taxis to try and go to the larger supermarkets to get fruit and veg. So the translation of a policy at the highest level has a lot of repercussions that the average Joe is having to deal with now. But with every crisis, there's usually a victory, and I do believe that this will hopefully make us as a nation find solutions to some of these things we take for granted, systems in place.
Yeah, I mean, listen, at a time like this, I mean, I think every country in the world that's in this fight is reliant on good leadership, effective leadership. I know that Namibia's president was recently sworn in for a second term. I do want to ask you about this, though, because as we talk about leadership and interventions and the examples set by our leaders, particularly in this moment, I was struck that the inauguration that happened on March the 21st happened with hundreds of attendees, including several African heads of state, at a time when Namibia had put out strict travel restrictions and had also put out messaging around people gathering in groups, basically prohibiting large groups from gathering. So, leadership is important. So I ask you this, I mean, what message does that send?
Well, it didn't go down very well, I must say, because I think just a few days before that, we had our 25th penciled in as our 25th anniversary independence. And all those celebrations were rightly cancelled. But the inauguration a few days later wasn't. So it was a bit of a dual standard, and it did send the wrong message to the populace. So I must say most of my work has been trying to communicate the right message to my patients, to the population, to different networks, just in terms of putting the unruly fear and panic, setting that to rest, giving the right information, and really just trying to support the different policies and helping communities understand them and to understand the implications of it. I will say I'm currently working with a small task force looking at the implications of the current lockdown on our economy, and whether these measures that are largely based on developed world economies work for our small nation. The Ministry of Finance just announced a stimulus plan, but that really is going to last a month or two. If our lockdown as it stands now continues, we may be seeing the repercussions from a public health and infant mortality and sanitation and education, all of these other systems that are going to suffer as a result of a completely demolished economy, we'll see those damaging sort of repercussions for years to come. So it's kind of balancing different agendas.
I'm almost out of time, but I do want to pick up on something you said. You talked about the work you're doing around messaging and trying to eliminate the fear that certain segments of the population will have at a time like this, and fear which we know that in many parts of Africa sometimes can prohibit people from seeking care in a timely manner, or just sharing what they're feeling, what their condition may or may not be. I know that you will have heard the comments that have been widely reported, the French doctors who were on French TV talking about a repurposed vaccine being trialed first in Africa before anywhere else. At least that was their suggestion. I just, as a medical practitioner, as a man of science, I just want to get your response to that before I let you go.
I saw the Dr. Tedros from the World Health Organization quite emphatically said, no, that will not be happening in Africa. The colonial sort of approach to testing things in Africa will not be sort of tolerated. I do think the vaccine itself possibly is, essentially it's that BCG, the old vaccine that most of the developing world has been using still as one of the first injections you get, the one that leaves the scar on your shoulder to protect you against TB. So there is some strong association that has been seen that countries with a high level of BCG vaccination seem to do quite well. But there's a lot of other possible confounding factors, weather, humidity, the socioeconomic makeup, their testing ability. So there's a lot of other things that could be sort of making the evidence less strong. So it needs to be tested. I heard of a study in Australia, for example, now of 2,000 or 4,000 people undergoing this vaccine. So we have to wait and see what the findings show, just like all of the medication trials that are going on at the moment as well.
All right, Dr. Azadeh, it's such a pleasure speaking to you. Thank you for giving us such an extensive view of the situation there in Namibia. Wishing you guys the very best. Please stay safe.
Thank you very much for inviting me.
You're welcome. See you again soon.
Bye.
There you have it. You get a sense of just the variation, across the continent. You talk to Albert in Rwanda, and he talks to you about social welfare programs and interventions that are happening there on the part of the Rwandan government to help the poor and the needy, because, Rwanda has had a pretty impressive trajectory in terms of its economic growth. And so they have the means to do that. They have also recently received some money from the IMF, about 109 million to help with meeting this crisis, but they can at least at this point in time intervene. And then you talk to someone like Dr. Azadeh in Namibia, and he tells you that that they are coming off of 5 years of drought. Commodities prices have dropped. Namibia, are involved in exporting diamonds, marine diamonds and uranium, and commodities prices have dropped, which has hit their economy. And there's the drought, and they're just in a completely different situation when it comes to the response. And so, it's not one size fits all. There are different conditions on the continent, different sized economies, and different responses because of that. So, it's all of that we have to look closely at when we talk about what is happening in Africa with the coronavirus. You can't just make blanket statements. You need the context, you need the nuance. So thank you to both of my guests there. Just a quick comment from Charlotte. Matt, that very informative. Thank you. Keep safe all. Thank you for sharing that, Charlotte, and for writing in. And thank you to everyone who is with us. As always, we give you the facts, we give you the information, but we also want to give you the bright side.
Oh, guys, come on. It's not that bad. Okay, fine. Maybe it sucks a little bit. Like the help. I could swear the house girl is stealing my bras.
Really? You know, I opted for no house help. It all just felt too much like colonialism.
But all of these things aside, there are still really wonderful things about returning home.
Exactly, you'll love it.
Yeah, I love it too, but just don't romanticize it.
The weather is perfect all the time. The restaurants, the beaches, the fresh mangoes, the coconut water that you don't have to drink out of a cardboard box, but out of an actual coconut.
Except Ngozi. Please, can you stop buying those cheap sunglasses from the side of the road?
I guess that was an African city. She's giving us the bright side, even then, looking for the silver lining to the situation. Please welcome everyone, the one and only Nana Mensah, writer, director, singer. I was reading it. There was like such a long list, Nana. I just gave up. The list was too long. Welcome.
Yeah, it's exhausting.
It is. Because you are, what is it? That's like you're a multi-threat. You're
multi-hyphenate. Yeah, that seems to be the term. I mean, really what it means is just like low level of various levels of employment. Like it's like just variously unemployed in different, métiers. Yes.
No, it is so nice to have you with me, hanging out at home. I'm in lockdown. You're there in New York City, right? Did I get that right?
Yeah, I'm in Brooklyn.
Lockdown. Talk to me. How is it going? Because you're looking very put together for someone who's in lockdown.
I mean, first of all, thank you for giving me an excuse to wear mascara today. It was much needed. I was like, oh, that's what I look like. Like it was. So yeah, I'm in Brooklyn. It's I've been on lockdown since March 12th. Mm-hmm. I was in rehearsals for a play, for Jocelyn Bio's play, Nollywood Dreams, and we were supposed to go into tech on the 13th, but then on the 12th is when Broadway decided to shut, and the off-Broadway theaters followed suit, so all of a sudden there was no show. So I went to Whole Foods, bought a lot of food, and then just came right home, and I've been home ever since. And so luckily, when you are in a dense environment like this, there are pros and cons. One of the pros, obviously, is that we have so many services that deliver to you. So we've been getting our groceries delivered, that sort of thing. So like any prescriptions, we have a prescription delivery service. So, tech has really been our friend in this, just being able to get everything that we need. And not have to leave the house. Luckily, we have a little balcony, so we've been able to sit and get some sun on days that it's not too cold. And my Pilates teacher started doing her classes on Zoom. So, I got it. I've got all my bases covered.
You got your food, you got your Pilates, you got your balcony. Exactly. You're good. But how are you dealing with as someone who is always on the go? Because I think I read somewhere that you were like saying, someone asked me like your motto, and you were like, it's like hustle, hustle, hustle hard. You're always on the move, right? So how are you dealing with the confinement, which a lot of people all over the world are having to kind of get their heads around? Like I've given up sleeping at a normal time. Like I'm up all hours. Like my whole life is upside down. How are you doing with the confinement?
I mean, I'm a Virgo, so I like structure, and I like things, kind of regimented. So in that way, confinement kind of works for me because it's like, you're not going anywhere. So you're here, you get to just be the architect of your day. So I wake up. I mean, listen, first things first, especially because I was just hearing the last guest. I mean, the name of the game is privilege, right? Like I'm so lucky to be able to, I have money in my bank account. My theater comrades who I was doing the play with, like not all of them work in television like I do. So, there's money in the bank. My rent is paid for. I know where everything is coming from. So in that way, big umbrella statement, I recognize my privilege. Mm-hmm. Now, that said, I wake up in the morning, I do a facial massage with my gua sha stone, for a good 20 minutes down.
20 minutes down, 20 minutes of the day, check.
Check, exactly. Then and I'll make a very leisurely breakfast that involves roasting something, and that will take that'll take an hour. And then I make my artisanal coffee, and then I do my, so I'm just very much languishing, and I'm working on a couple of writing projects. And so that also, that also keeps kind of my mind stimulated. But I think, there are all these memes that were going around that were like, Shakespeare wrote King Lear, during his lockdown, and so wrote this, and Tolstoy did this. And I'm like, listen, I'm none of those guys. But if I do like a good 30 minutes, that's great. That's a great way. But that's what I'm doing.
I don't know why you telling me about making artisanal coffee brought tears of laughter to my eyes, because it's so Brooklyn. I mean, I'm Brooklyn, right? Because I live in LA, and there's a lot you could say about LA. But there was something so apropos about that image, you roasting and making artisanal coffee.
I mean, why not? When am I ever going to have this chance again? And then and mind you, that's only the morning. So then I'm like working on the beats of a pilot that I'm working on, and I'm working on, so I'll do like little projects in that way. And then I start dinner at 4:30. I start the process of making dinner at 4:30. And so dinner's ready by 6:30, maybe, depending on what I'm making. And then, eat and then bed. Why not?
You're making me cry with laughter. I think, you know what I'm taking from this? I'm mocking, but I'm mocking Brooklyn's artisanal flair. I love you. I love you, BK. Don't drag me. I'm not. No. But what I really appreciate about what you said was how you're leaning into the moment, right? Yeah. It is what it is. And I know, again, I understand, there is a context. You are fortunate, you're privileged, as am I, to be able to do this and not be worrying about, what comes next and whether you can make dinner. So that is fully acknowledged. You're leaning into it and not being resistant to it, to the kind of confinement, and that makes it a little bit more bearable. And I think there's something in that for people to take. And also what you just said also struck me that, people were talking about, Shakespeare and Tolstoy. It's not putting too much pressure on yourself to be overly productive in this moment.
That's right. I think a good friend of mine sent me an article. I can't remember where she found it, but that basically we have no idea the psychological toll that this is going to take on us. What this heightened state of because don't get me wrong, that first week I was on New York Times every minute. I was getting all the updates, listening constantly, news. Now, when I'm drinking my coffee, I listen to a couple of podcasts that kind of, Up First and The Daily, so New York Times, NPR, just to get a little snippet, and then that's it. And then everything else from there is either creative, watching films. I got a subscription to the Criterion Collection, so I have this, just this whole wide swath of movies that I can watch and study, and just kind of look at the way other people tell stories and just engage in story and work on that creative side of my brain. Mm-hmm. I think we are currently grieving our way of life right now. Mm-hmm. There's no way that we're going to come through this unchanged, right? Just like everyone. Whether it's shaking hands when you meet people, or what you do when you have to sneeze in a crowded theater, or how you behave or how you receive that information. There is a way of life for me that ended on March 12th, 2020.
Wow.
And I think that grief and that grieving process is going to take God knows how long. So I think just for as gentle as we can be with ourselves, what you're saying is right. It's just kind of not to sound like a typical ridiculous millennial, but just self-care,
Yeah.
And that idea of I'm going to be gentle with myself, because I don't really know subconsciously how I am taking in the way that all of my years have been lived up until last month, and what it's going to look like after. You know what I mean? It's our grandkids at our gravesite are going to be she lived through 9/11 and the coronavirus epidemic. Those are going to be those defining things that our grandkids are going to say to us at our grave. So this is a huge thing, and just I'm not going to decide on what needs to be accomplished in this time. I'm just going to take it day by day. I'm going to enjoy it as much as I can. I'm going to take care of myself, and I'm going to encourage my friends to do the same.
So let me ask you this, because you are a storyteller, you write, you actually do it all. Again, you're multi-threat. But as we talk about stories and we talk about what comes next, And you said something about, how, effectively culture is going to be changed by this, shaking of hands and how we gather and how we interact. I mean, when it comes to Africa, how do you see the story changing or shifting? I don't know. I mean, you're spending a lot of time being able to sit and think. What do you think this moment means for our narrative? You're a storyteller. What stands out for you?
I mean, I'm not sure yet because I'm in the center of the epidemic right now, of the pandemic. New York is basically the epicenter now after Italy. And because when I speak to my parents, who are in Ghana, my dad is in Ghana, my mom got locked out of Ghana, so she's currently here, but she will be there. Yeah, she's fine, but she just couldn't she was on the last flight back and then it got canceled. So she's now in the States, but intending to be back in Ghana, reunited with my father. But when I speak to my dad, he's taking precautions, but it's a little bit different. The lag there is a little bit different in terms of course, the rate of infection, but also especially just getting accustomed to changing our behaviors.
Yeah.
And, I really don't know. I'm really curious about what this means for how Africa, shifts. And
what stories will come out and what creativity will come out of this moment. Where are you drawing inspiration from right now? Because that's what we talk about on the show at the end of every show.
Yeah, I am drawing inspiration from, like I said, kind of doing these deep dives on like older films, things that I either missed just like in the cultural moment, or like, so I'm going back to movies from like this, like that I was alive in the 70s, but then also like 80s, 90s, like looking at older films. I'm going back and watching some TV that I either missed or I was not, like, for example, The West Wing.
Yes. I love West Wing.
Love The West Wing. I watched some episodes as a kid, but like come on, I know way more now than I did then. So there was things that are just going over my head then that I'm now like, Jed Bartlett for president. Like, it's like, please, where are you? Come save us. Like, what would Jed Bartlett have done during a pandemic? I'm only in season 2, but I would love to know if they had a pandemic in the West Wing. But I just am so excited by all the storytellers who have come before me and just kind of learning what I can from them in this time, because this is like a crazy incubator time. The only thing that can happen right now in terms of like Hollywood is development. That's it. That's all we do now is like, nobody's shooting anything. Nope. Like it's all stopped. So the only thing we can do is figure out this next round of stories. And I did go back and watch Contagion, which was... Oh,
you did? I haven't seen it yet. I think it might be a little too intense for me.
You've never seen it?
Never.
It's excellent.
Really?
I found it weirdly uplifting because they defeat the virus in the end. And that virus is way more vicious than coronavirus. So in that way, I was kind of like, it's not so bad.
Nana, we're going to pick up this conversation at the top of the hour. So in 2 minutes on Instagram, I'm going to keep this conversation going with the one and only Nana Mensah, one of the stars of An African City. Before you go, I do want to say, read this to you because you may know this person, Nicole Amatafir.
Oh, I've heard of her.
You have heard of her. Grieving our way of life. Perfectly said, Nana Mensah.
Aww. Hi, Nicole.
Nicole is the creator of An African City, for those
of you who don't know. Nicole is my boss.
Be like, hey, boss.
Hey, boss.
I'm going to see you over on Instagram in 2 minutes, top of the hour. We're going to keep this conversation going. And I want to hear more about this exfoliating thing that you're doing.
Oh, Lord. I don't know if we have that much time, but I'll tell you.
I'll see you on Instagram in 2 minutes.
Yeah. Bye.
Bye. Thank you. Thank you to you for spending time with me on this Tuesday. I hope you found the conversations insightful and thought-provoking. And do join me again tomorrow, Wednesday. I'll be back here, same time, same place. That is 12 p.m. if you're on the West Coast, 3 p.m. if you are on the East Coast of the United States, and that is 7 p.m. GMT. So join us again. I promise more great conversations, more dialogue. We're going to get through this together. Till tomorrow, please stay safe. Take care, everyone. See you soon. Bye for now.
Sing it.